I'm going to do a little video on how to activate your deep core. So you can do this by sitting on the edge of a chair, the edge of a couch, or one of these balls. But sitting up nice and tall is important, and having some feedback on your pelvic floor. All right, so this all starts with proper breathing. So go ahead and place a hand on your chest and a hand on your belly. Take a deep breath in and notice what rises, your chest or your belly. If you're like most people, your chest is gonna rise when you take a deep breath in, and that is because we are so taught by society, so trained to hold our bellies in tight, that our breath restricts into our chest. But the proper way to breathe is to allow the belly to fully release and relax and expand with the inhale. So first step is to master that. Go ahead and practice with some deep inhales, allowing the belly to fill nice and big, and just exhale naturally. Go ahead again, deep breath into the belly, let it grow as big as you can, like a balloon, and exhale naturally. So if you feel like you're not getting this right away, don't worry. It's probably something new, and it may take you some time to get used to. But make sure that you have a good feel for that before you move on to the next step, step 2. So step 2 is about the Kegel. If you're not familiar with the Kegel, I suggest looking up some information about how to do a Kegel so that you get a nice visualization of what the pelvic floor looks like and what we're trying to accomplish with the pelvic floor. But you can think of the pelvic floor like a clock, and you want to bring both ends, the 12 and the 6 of the clock, together. So the top of the clock, the 12 being like up by your pubic bone, right at the top of your pelvis, and the 6 being at the other end, pulling those together and then pulling the opposite ends of the clock in together. So all ends of the clock are pulling in towards each other, and then we're lifting straight up through the center. So that's one way to visualize it. I really like thinking of picking a wet towel up off the floor, or a penny, or some people like the visualization of like an elevator. Either way, you want to think of pulling together and then lifting all the way up through your center. So why do we strengthen the pelvic floor? This prevents incontinence, peeing your pants. And it also is the basis for our core and for all of our whole body, really. So it's going to help protect your back, have a nice strong belly, nice strong body, prevent injuries. Okay, so you want to try and get a feel for this Kegel. You want to do the Kegel on your exhale, okay? So we can go back to placing a hand on the chest, hand on the belly. Take a deep breath into the belly, letting it release on your inhale, and on your exhale, lifting all the way up through your center with the Kegel, okay? Practice that a few more times. Deep breath into the belly, release, and exhale, Kegeling up through your center. So a cue to pay attention to is if you're clenching your butt cheeks, you're engaging too much in this exercise. The Kegel is a small movement. You cannot see it externally. It's all internal, which is why it's a really tricky move to master. You can't even tell if you're doing it right a lot of the time. But with practice, you'll get more confident at it and feel like you're getting it down. All right, so that is step 2. Deep breath into the belly is step 1, letting it fully release, growing nice and big. Step 2, on the exhale, lifting up through your center with the Kegel, squeezing up. Okay, so we're gonna add a third step to this. Those first 2 steps alone are a great exercise to practice. You can practice those anytime. Great for keeping the pelvic floor nice and strong. But we're gonna practice engaging the transverse abdominis, which is gonna be responsible for keeping some tightness here in the belly, You can practice this while you're pregnant, postnatal. All three of these exercises are good to do pre and postnatal. And it can really help keep some tightness through your belly during this transition time for your body. All right, so the third step with the transverse abdominis, I want you to think of pulling a sheet of saran wrap up over your belly and pulling it tight, like all the way up over your shoulders. That's gonna start at the top of your pubic bone all the way down here. Lifting, lengthening all the way up over. So it really is like a sheet of muscle that we're pulling up, and you want to be able to hold tension in that muscle nice and tight. It's not a sucking the belly to spine feeling, it's a lift and lengthen. If you're pregnant, it's a great time to get a feeling for this exercise, because getting underneath the baby bump, you're gonna feel really nice activation coming from under here, lifting and lengthening up. So we're starting from all the way down here, engaging, lifting and lengthening. If you're pregnant, wrapping around the baby. We call it hugging the baby, wrapping all the way around and pulling up. If you're pregnant, you'll see literally like a lift and wrap around. You'll see that when you're doing it properly. If you're not pregnant, I'll show you kind of what it can look like. It's a lot harder to see, but hopefully I can give you some visualization here. Okay, so we take a deep breath into the belly, releasing. We're gonna do all three steps here. So releasing the belly, let it grow nice and big. Exhale, Kegel, lift and lengthen, and then wrapping, pulling up here through the transverse abdominis, getting a nice lift and lengthen here. So we inhale, release, let the belly grow big. Exhale, Kegel, which you can't see, but then we do the lift and lengthen up. Let me do that one more time for you. Inhale, release. Exhale, Kegel in the center and lift. So I feel most of this right down here in the way lower belly, lifting and pulling up. All right, so when you have really mastered this and you get a feel for how this goes and how to engage your belly here, you can practice this holding move with anything you're doing. So holding the activation of the transverse abdominis, you can hold that activation and give yourself a core workout really with anything you're doing. So you can be doing bicep curls here, holding this tightness in your abs. You can just be standing, talking to somebody, and if you have practiced well enough, you can be engaging with this lift here and giving yourself an ab workout all the time. Not to mention, it sets you in really nice posture. As you practice it more, it's gonna set your shoulders back, lengthen you up all the way through your spine. So, those are the 3 steps of deep core activation.